Hi, my name's Sydney. I'll be doing your HIV testing today.
Hi Sydney, it's nice to meet you.
Nice to meet you too. So have you ever been HIV tested before?
Once a few years ago.
Okay, so I'll then just briefly run over the process again just to give you a little bit of a refresher. So this test is an oral swab. It'll take about 10 to 15 minutes to develop, and during that time we'll just have a brief discussion about risks and then some further steps that you could do to keep yourself safe.
Okay.
So there are 3 different results that you could get today on the test. One would be a preliminary positive. This means that HIV antibodies were found in your system, and we would send you to a place like Positive Link to get a free confirmatory blood test. The second result you could get would be non-reactive negative. This means that no HIV antibodies are found in your system. However, if you were exposed within the last 3 months, the test may not be able to pick that up. And then the last result we could get would be invalid. This just means that something's wrong with the testing device. We'd get a new one, re-swab you, and move on from there. Do you have any questions?
No, I think that makes sense.
Okay, so then we'll move forward with your test. Give me a moment to set this up. So you're going to take this swab and rub it on the inside of your gum line, so like this.
Okay.
And if you could do the top and bottom for me, that would be great. I can't open it. Okay, I'll take that. Thank you. Okay, so now we're going to move on into the risk assessment portion of this while we're waiting for your test to develop. So what brought you in for testing today?
I just saw the sign outside. I thought it was probably not a bad idea. And it's rainy, so it's dry in here.
I don't need much more motivation than that to do things. So do you have any specific risks that you're concerned about?
I don't think so.
Okay. So if anything comes up while we're talking, please feel free to interrupt me. The session is meant to be all about you. So it's not meant to be me just talking at you and you just sitting there taking stuff in. I want this to be more of a conversation.
Okay.
And then some of the questions I'm going to ask you are personal. So if you feel uncomfortable or don't want to answer them, feel free to let me know. I'll move on. I'm not going to be upset or anything like that. So to begin, are you sexually active?
Yes.
Okay, so do you have multiple partners or are you with one partner?
Well, I had a steady boyfriend for about 3 years,
Mm-hmm.
and we just broke up a couple months ago, so I've kind of just been exploring my options.
Okay. So when you are with your partners, do you use protection?
Most of the time.
Okay, so what does protection look like for you?
Usually it's a condom.
Okay. So if you could give me a percentage, how often are you using a condom?
80% of the time, maybe.
80%? Okay. So, like, when you have those conversations with people, like, what are the reasons why you wouldn't use a condom?
Probably just because I don't have one on me, or the other person doesn't have one kind of in that moment, and so I just don't do it then.
Mm-hmm. And that makes perfect sense. So on a scale of 1 to 10, how concerned are you about getting an STI?
Well, I know the people pretty well, so I feel like if they were making risky choices, I would know that, or if they weren't healthy, I think I could see that, so I'm not that concerned. Maybe like an 8.
An 8? Okay, so why are you not like a 3 or a 4?
Because I think I can trust them.
Okay, so that makes sense. So just to summarize so far, you are currently sexually active, you had a steady boyfriend for about 3 years, and you recently broke up, and now you've been exploring your options, and you are using a condom most of the time, but about 20% of the time you're not. And usually that's due to you not having one and just kind of being in the heat of the moment. And then you are you're not very concerned about getting an STI because you feel like you know your partners pretty well.
Mm-hmm.
So when you say you know them well, do you have discussions about each other's status? Or like if you've been tested for STIs or HIV before?
No, not directly.
Okay.
I guess I just, I think if there was something I should know, they would tell me.
Okay. So you feel like you have a lot of trust with these partners?
Mm-hmm.
Okay. So why do you like not have those conversations? Do they make you feel uncomfortable or?
Yeah, like if I'm asking them, then maybe they think I'm like accusing them of having an STI, or they think that I don't trust them, and I don't want to ruin the mood.
Okay, so if you want to play along with me, so if it was flipped around and one of your partners asked you, like, have you been tested before, what's your status, how do you think you would feel?
I guess I probably wouldn't mind, and that just shows that they're being conscientious, and you know, I'd want them to know about their other partner, so if they were asking me, I would probably be okay with that.
Okay. So, I mean, that is something to think about too, that most likely they're going to have a similar reaction to you as well. I know it can be kind of anxiety provoking to think that, like, oh, what if they think I'm questioning them, or like think they're not clean or something like that. But I think a lot of people would have a similar reaction to what you were just saying.
Okay.
So when you, like, do you bring up to your partners that you want to use a condom, or like what does that conversation look like?
Usually if I have one, you know, when the opportunity presents itself, or before we get too involved in things, I would just give it to them, or I would, you know, if I didn't have one, I would say, you know, do you have a condom? But if they say no, then I don't usually push beyond that.
Okay. So kind of moving in a different direction, do you drink alcohol?
Yeah, like on the weekends.
On the weekends? Okay, so what does a typical night of drinking look like for you?
Well, like, I want to save money, so usually my friends and I, we have a couple shots before we go out, and then, I don't know, I might have a few drinks, at the bar, maybe like 4 or 5 drinks.
Okay. So, when you drink, do you notice if you become, like, any more sexually active, or do any riskier behaviors?
I like to think I'm still pretty in control of myself, but it is fun, you know, to have sex when you're drinking, so I probably do that more often.
Okay. So, do you notice any changes, like, in your condom usage when you have sex while you're intoxicated?
I guess I still probably, you know, if I have it or if he has one, then I would still use it, but I'm probably even more in the moment or in the mood when I'm drinking, and so I would probably be even more inclined to just go forward with things even if I didn't have a condom.
Okay. So, what concerns you the most about not using a condom?
I mean, like I said, I trust the people. They're like people I have classes with, and I see them around, and they're not like sleeping with everybody. So I don't know. I guess I haven't been that concerned with it. I didn't really think about it being a problem or something that I should worry about.
Okay. So, just to summarize again, you do drink alcohol, but you are typically doing it with your friends and you feel like you're still in control. You do notice that you're a little bit more sexually active, but your condom usage doesn't change that much, and you've clearly thought about the different things that could potentially happen too if you don't use a condom, but it's not something that you're very concerned about because you feel comfortable with your partners and you're having those conversations about their status and all those kinds of things.
Yeah.
Okay. Do you use intravenous drugs or drugs that involve a needle?
No.
Okay. It might seem like a weird question, but that is one of the main ways that HIV can be spread. So if that is something you're doing, we just want to make sure we have that discussion.
Well, it's a problem. I mean, some of my friends do use IV drugs, so, you know, I appreciate that you ask, because I know that people do that sometimes.
Is it something that, like, bothers you or that you talk to them about?
Well, I just usually don't hang out with them when they're doing it, but if they're sober, then, you know, who am I to judge?
Yep. I mean, they're your friends, so it can be kind of a difficult situation, but they're lucky to have you and watching out for them and, like, knowing those kinds of things. So we're going to pivot again. So the next thing we typically like to do is come up with a risk reduction step. So this is something that you can do in order to lower your risk of getting HIV or other STIs. It's something that you come up with. If you want my help, I can give you suggestions, but we like to give you free rein in coming up with whatever that thing is. And it just needs to be one step. It doesn't need to be like a whole master plan for your life. So if you want to take a second to think about it, and then you can write it down on those lines, and once you come up with it, if you wouldn't mind sharing that with me.
Okay, so I just said that I will have a condom with me before I leave the house to go out with my girlfriends on the weekend, because that is kind of a time when I know that if I see a cute guy and have the chance that I probably am gonna not wanna have to say no because I don't have a condom.
I think that's a great step. On a scale of 1 to 10, how confident do you feel that you could accomplish that risk reduction step?
Like a 9 or a 10. I feel pretty confident about it.
Okay, that's awesome. So why is it not like a 2, with you not being very confident?
Well, because, I mean, I think I can afford a box of condoms, so it's just a matter of, like, making that part of, I don't know, maybe my grocery shopping or something. I go shopping once a week, so if I'm out, I can just pick some up then.
Yeah, that's really easy. You could even set a reminder on your phone or something like that. And we have plenty of condoms here today that you can take. And then CCP also has a condom club where you can sign up to get a free box of condoms every month.
Oh, that's great.
That's another thing to think about. So besides like maybe forgetting when you go to the store, do you see any other barriers that could get in the way of you accomplishing this step?
No.
Okay. So before we go over what your results are, in the event if you were HIV positive today, do you feel like you have people you could talk to or those you could turn to for support?
Yeah, probably like my sister.
Okay, that's really great that you can identify that so quickly. How do you think your life would change if you did have HIV?
Gosh, I don't know. I've never really known anybody who had HIV, so I know like it used to be maybe a lot scarier or like something that we heard about a lot more when I was younger. But I think maybe there's some medicine now, so.
Yeah, do you mind if I share information with you?
Sure.
Okay. So there's 2 different types of, there's antiviral retrotherapy or ART, and that's the medication you would take if you did have HIV. And it actually is going to prolong your life for a very long time. So like you were saying, it used to be very serious. It's still a serious disease, but it's definitely a lot more manageable now. So like the average lifespan of someone in the U.S. is I think around 75, and for someone with HIV it's 72. So
wow.
You're not looking at a huge life decrease as long as you're going to those doctor's appointments and taking the medication. And then if you are worried that you may have been exposed to someone who has HIV, you can take post-exposure prophylaxis or PEP. It's similar to Plan B in the sense that it's supposed to protect you if you did have those unexpected exposures, and it will protect your cells from potentially getting infected with HIV if it did make its way into your body. And the other medication that's available is something called pre-exposure prophylaxis. This is similar to birth control, where it's something you would take on a daily basis to protect your body if you were exposed to HIV.
Okay.
Okay. Are there any other questions or like things that are floating around in your head that you've had questions about?
No, I think that's all.
Okay. So are you ready to hear your results?
Oh. Yeah, I'm a little nervous now, but I think I'm ready.
Okay. So you are non-reactive negative. This means that no HIV antibodies were found in your system, but if you were exposed within the last 3 months, it wouldn't show up on this test. So you probably want to come in and get tested between 3 and 6 months. So we're always having free testing events, and I know there's other ones going on in the community as well that you can keep an eye out for. And then, yes. So, how are you feeling after hearing your results?
Oh, I'm definitely relieved that I'm not HIV positive, but I think kind of hearing that there have been so many advancements in medication and healthcare, I guess that's just good to know too.
No, and there's definitely a lot of support in the community. I mean, we have resources listed out on this sheet that you'll take with you. If you ever feel like you need support or you have friends or there's just people you want to reach out to and get more information, those are all really great options. And then on a related vein, do you know the Back Door? It's a bar in Bloomington.
Yeah, I think I know where that is.
Okay. On the first Thursday of every month, they do free gonorrhea and chlamydia testing, and you don't have to be 21 to go.
Oh,
so
cool.
It's another great option to know your status for multiple different things besides just HIV.
Awesome, thank you.
No problem. And then if you want to go ahead and write down the date that you were tested, just so you can have it for your reference to know when you've hit that 3 to 6 month mark to come in and get retested. But other than that, if you don't have any questions, we are good.
Okay, thank you, Sydney.
Thank you.